possible recommendation into costing scenarios. This requires, of course, a lot of discussions because there's no right and wrong way of doing so, because when you put together people from different ministries, people from different agencies, they would have different ideas about it. And a lot of it is on how you decide and how you prioritize your policies, basically. So I'll just give you an example from Indonesia. And I give you the simpler example for now. For instance, for children, recommendation number 1, to expand CCT program. The scenarios that we apply consists of 2. The first one is the CCT to all poor households, not only very poor households, which is now the target group, in all provinces at current level of benefit. This you can already have an idea. Basically, you just add the number of people in all the provinces based on the data you have on poor households. The second one, because during the assessment we also found that studies on the impact of CCT show that there is very small impact on school attendance for children aged 13 to 15, because the benefit they receive is much lower than the wage they would receive when they are working instead of going to school. And thus, for this recommendation, we add another scenario that CCT to all households, to all poor households would be given, and the benefit for this age group would be increased based on what we found during the assessment based on previous studies. And recommendation number 2, to explore and calculate the cost of Universal Child Benefit Program. It's a much simpler. Universal programs are usually much simpler than targeted programs, of course, in terms of costing and in terms of implementation, because we simply take the number of all children, and the data is more reliable in the sense in Indonesia. And we would give child benefit to all children within a certain age. The working age recommendation has, in the end, had only one scenario that we costed. We did consider other scenarios, but this was the most solid one to cost. To establish a public work guarantee linked with vocational training. And this is based on experiences in other countries and based on similar smaller programs in Indonesia. We would give 30 days of work per person per year, plus 10 days of training every 5 years. Of course, you would also have discussions over other things than just the number of days and of training and number of days of work. You would discuss the wage, you would discuss whether they need other assistance. But for now, this set is good enough for us to present in terms of monetary value. The elderly and people with disability. I don't have the scenarios for health here because health has 9 scenarios. It's a lot because it's based on what the government is currently doing, and there's 3 levels, and yeah, it's more complicated, but it's basically the same idea. So the last one I present here is for elderly and people with disability. Scenario number 1 is the extension of non-contributory pension for all severely disabled persons, which is now only around 10% covered. And second is the extension of non-contributory pension for all vulnerable elderly without family support, which is also similar. These 2 programs currently running are with the same method. They are under the same ministry, and the type of assistance is the same, and the targeting system is the same. The third one is the establishment of non-contributory universal pension for the elderly. But we have several options. Of course, now the pension age is 55, which which was decided in the 50s, in the 60s, when life expectancy was 60, of course. Now life expectancy is over 70, 71. And that has not changed. So we also want to have another scenario that would accommodate a more recent situation where non-contributory universal pension should be given to people of 65 and older. And of course we can also have other scenarios, 60 or 70 and so on. But this is to give an idea of the different types. Then we can make a combination of the low scenario and the high scenario, because when we present it, then from 8 scenarios, for instance, we can have a combination of the lowest and the highest. And here we can see that the first and second one is a must. These are most vulnerable people that the government has the obligation to protect. And at the least, this is the gap that we should fill first. So the low scenario consists of scenario number 1 and number 2, where all these most vulnerable groups are covered. And the high scenario is where all, sorry, it's not 4 but 3, because of course the scenario number 4 has lower expenses than number 3. But basically the high scenario would include universal pension for the whole elderly population, and of course severely disabled population. So we can get a combination of the low and the high, and or if you want, you can have a middle one in between. Now the last part before going on to costing is making the assumptions of the scenarios. Let me give you an example from old age and disability benefits. Scenario number 1, for instance, extension of non-contributory pension for all severely disabled people. There are assumptions that we can already make based on existing program, existing data. For instance, the benefit amount of 300,000 per month, which is at the current level of current program. JS Pacha is the name of the program currently running, and it increases with inflation. There's a few decisions, several decisions that we can make on this line only. First, whether you want to stick with the 300,000 rupiah per month, whether that's reasonable or not, and you discuss this among the group. We decided that this is reasonable for the moment because it is slightly above the poverty line, and at least at the poverty line, then people is assumed to be able to live on. This is the average national poverty line, because we have a provincial poverty line. And how do we want to increase it in the future? Is it inflation? Is it based on average wage increase? And we think because this is the level that is required for them to be able to live on for their daily lives, then inflation should be appropriate to take into account. The number of the target group. This is quite tricky, and I'm sure in many of your countries also, the number of disabled people is something quite difficult to get, because first you need a firm definition of disability, and then you need to have reliable either survey or census of how many there are. And in Indonesia at the moment, we do not yet have the actual number. We have some estimates from the Ministry of Social Affairs, and this is the only thing we have, and we have to use it for now. Although part of the recommendation is to improve this database, and the government is in the process of improving the database, because then the national survey would include disability in it. But for the moment, we have an estimated number from the Ministry of Social Affairs, and well, that's the best we can have now. The third assumption is how much do you want to cover? Currently, the coverage of the existing program is at 11.8%, and of course, because this is the most vulnerable part of the society, you want to cover all. So your target would be 100%. So you need to make the take-up rate based on that. So you increase it year by year, whether you want to cover it 100% by 2020 or before or after. So this you make the decisions also. The last assumption is the administrative cost, which is also naturally part of the cost. And we used experiences based on similar targeted programs, which is quite high. Of course, targeted programs have higher administrative costs, and this kind of target group is especially quite specific. So the administrative cost is quite high, 15%, based on similar programs that have been running. So these are the assumptions that we make in order for us to start doing the costing. Let me take you through one more example, also from old age and disability benefit. And this is the establishment of a non-contributory universal pension for 65 years and older. The assumptions here, I would say, is simpler than the previous one because, of course, the database is more reliable. We have a very good population data based on census, and we have also population projection that the Bureau of Statistics and the National Planning Agency has. So because our target group is the whole population of a certain age group, then it's quite easy. If you have the data of the population per age and you have the projection over a few years, then you already have your target group quite easily. So first is the number of beneficiaries. This we just take based on population projection of 65 years and older, which is available. Then the take-up rate you would decide. This is completely a decision made together, whether it would be realistic to increase it by 10% per year or not, or more or less. The third assumption is on the amount of benefit. This is also a decision that you make as a group, and you can have several different assumptions, different scenarios that you can show, and you can choose from. We can start with benefit at the poverty line. It makes sense. That's the amount you need for a basket of goods you need to live on. So we start with that, the benefit at poverty line, and we assume it to increase with inflation. There's a few discussion whether poverty line would increase based on inflation or increase based on wage increase, because the more people are making, of course, spending would be more, and then the poverty line should also take that into account. But there's no projection for poverty line, but we simply see that in the previous years, the increase of national poverty line is more or less in line with inflation, so we just apply that for now. Unless you have other arguments, then that can be applied. And the last is on administrative cost. This is a universal scheme. Administrative cost is lower, so we put 5% based on previous universal schemes, previous scheme.